Hi, I'm Nigel Hsu. I'm an orthopedic surgeon with Johns Hopkins at Howard County General Hospital. I specialize in foot and ankle surgery. Achilles tendinosis is a degeneration of the tendon due to wear and tear. It can happen in the midsubstance of the tendon or at its insertion. The patients may experience pain, tenderness and fullness at its tendon or the insertion site in the heel. Patients at risk for Achilles tendinosis are usually middle-aged people with a tight Achilles tendon. Athletes and runners are also at a higher risk of developing Achilles tendinosis. For patients with severe Achilles tendinosis, we may recommend a trial of boot brace immobilization, icing, heel cup, and anti-inflammatory medicines. Once the tendon pain has improved, we'll transition out of the boot and start physical therapy. This involves eccentric strengthening and stretching of the Achilles tendon. Surgery is generally reserved for patients who fail conservative treatment. Either the boot doesn't help enough, or when they wean out the boot, their pain returns and they have to go back in the boot, and we can't live our lives in the boot, and that's when we would consider surgery. We may also recommend surgery for patients who had an acute rupture with a diseased tendon. Plantar fasciitis is related in that generally this happens with patients in tight heel cord, and they can have degeneration at the bottom, which is plantar fasciitis, or on the top, which is the Achilles. When patients fail conservative treatment, we may get an MRI to look at how much of the tendon is involved. Surgery depends on whether it's a midsubstance Achilles tendinosis or at its insertion. Surgery generally involves resecting or cutting out the diseased tendon. We may need to reconstruct the tendon back down to the bone and resect part of the bone spur as its insertion. If we have to resect more than 50% of the tendon, we may also need to do a tendon transfer to augment the repair. After surgery, patients usually go home the same day. They're asked to be non-weight bearing for 6 weeks and start to weight bear in a boot at 6 weeks. We also progressively stretch the tendon back to neutral and then start physical therapy to rehab to get them back to their daily activities. Full recovery after surgery can take up to 1 year. Generally, patients have a good outcome after surgery and they can return to their normal activities without pain.